Hello, my name's Abigail Doyle and I'll be doing my fetal pig dissection. Okay, to start off, I wanted to measure my fetal pig to see how old it is, and then I want to identify its gender. So to get its fetal age, I'm gonna measure, I'm using a piece of string right now, I'm gonna measure from the tip of its nose to the base of its tail. Okay. I'm gonna mark that with a pen. Okay. So I have my string marked with 2 little dots right here. Okay. And then that comes out to about 12 inches, which converts to about 30.5 centimeters. So with that measurement, I estimate my fetal pig at anywhere from 112 to 115 days, if not older. Okay, so I'm gonna move on to identifying the gender. Okay, so as you can see here, this little spot right here is the urogenital orifices. So with it being located here, my fetal pig is a male. Okay. I'm gonna move on to identifying some external features of the pig. I'm gonna start off with the pig's nares, which are right here, and then along with the pig's tongue, which is right here, and the pig's eye, there's one, and then another. Okay, and there's his pinnae, also known as his ears, and then we'll come down here. This is his umbilical cord, and then these little dots that go down his stomach, abdominal area are his teats. Okay. So I'm gonna secure my pig and I'm gonna move on to that dissection when we get back. Okay, now that I have my pig secure using a couple rubber bands, I'm gonna start to make my incisions. So I'm gonna start with some initial cuts that will be shallow, cutting only through the skin. After making the initial incisions, I'll cut deeper through the muscle. So I'm gonna begin at the throat and make an incision along the midline of the chest towards the umbilical region. And then I'm gonna go around the umbilical cord on both sides. Okay, and then I'm gonna extend these cuts into the pubic region. Okay, and then I'm going to make 2 lateral incisions, one along the base of the rib cage and then another at the hind legs. Okay. Okay. So now I'm going to work on cutting deeper through the muscle tissue, and then I will fold back my flaps to expose the internal organs. Okay, and now I'm gonna open up the thoracic cavity. So I'm gonna cut away the ribs on either side of the rib cage and completely remove the chest plate. Okay, we're gonna work our way from the superior end of the pig to the inferior. Okay, so right here is the heart, and then on both sides we have a lung. Okay, and then when we move down, there's a little muscle right here. That is the diaphragm. And if we keep moving down, this is gonna be our liver. So heart, lungs on both sides, diaphragm, liver. Okay, and then we're gonna kind of lift this up out of the way. Let's see. So this little sac right here is gonna be our gallbladder. Let's see. And so this right here, this little oval shaped organ is going to be our spleen. Okay, and this is the stomach. So we're going to move down here. And this bit right here is going to be our pancreas. Okay, and then we're going to keep going down. This is our large intestine right here. Large intestine, and then this is the small intestine. Okay, and then back behind the intestines sits the kidneys. So on both sides, we have a kidney right here. It's that little bean-shaped object. And then we also have a kidney on this side. That is also a bean-shaped object.